so much for this gracious opportunity to speak to this batch of health management and hospital administration program at Symbiosis International University. And this is an induction program, and it is always cherishing to speak to young professionals, and therefore I look forward to interact with you uh, with more enthusiasm and talk to you on my views in the context of public health. Because I think this is the stepping stone for all of you in the arena of public health. And being an induction program, it would be judicious that I focus on very basic, fundamental, introductory aspects related to the public health. Because public health is such a diverse and vast field that it incorporates multiple dimensions. But for the sake of induction program, I articulated my thoughts and wanted to share with you, which are very basic and fundamentals to give a glimpse of what public health is all about. And in fact, the title that has been suggested by the university, A Bird's Eye View in India, also actually tells me that I need to take a much more macro view of what public health is all about. But at this outset, let me thank Professor Rajiv Erwadekar and the organizing team at Symbiosis International University for inviting me to participate in this important induction program. And let me begin with what I'm going to talk to you in next 40 minutes or so. I'm going to talk to you about what is public health, because as I mentioned to you, you all are very new to this field, and therefore it is important to understand what public health is all about. Who is a public health professional? Because now you are going to be the part of this public health family, a global public health family, and therefore you need to understand who is a public health professional. Then what are our public health challenges in national and global
Sir,
context?
may I take 1 minute, sir?
Yeah, sure.
No,
Sorry to
Ankit,
interrupt, sir.
Ankit,
Yes.
carry on. I don't want to disturb in between. There was some network issues at my end. So, hi, Sanjay. We'll catch up later. Thank you for honoring our invitation.
Thank
Thank you,
you.
sir.
Thank you, Raju. Such a pleasure.
Sorry, sir.
Always a pleasure. Please carry on. Please carry on. Sorry to.
Sure. No, not a problem.
Yeah.
So what are our public health challenges? And then how do we respond to these challenges? And more importantly, to understand what influences our health, because public health is an instrument in advancing health. If we all have a dream of healthy India, then I see public health as a tool, as an instrument to see that how do we make our country healthier. But then how do we strengthen our health systems in India? And finally, to understand, because the goal is, I would say, a long-term goal towards healthy India is to see that how do we take forward health assurance and the sustainable development in a national context, which will contribute to a healthy India. So that's the scope that I have decided to talk to you all about. So let's begin, as I mentioned to you, to understand what public health is all about. I'm presenting you two simple definitions of public health. And I also wanted to mention you, people looked at public health from a very diverse and variety of the ways. And you would find there are multiple definitions of public health. But I picked up two definitions of public health with a gap of 90 years. They are being presented to all of us with the intent to tell you the scope of the public health. The first definition, which is very familiar definition, and some of you might be aware about, is the Winslow's definition. It's precisely 100 years back in 1920. What he told us about public health is the science and art of preventing disease, prolonging life, and promoting health and efficiency through organized community effort. You can see there are three important areas of activities. How do we prevent disease in the community? How do we prolong the life in the context of life expectancy? But it does not mean only adding the numbers to the life, but also looking at the quality of life and the dignity of the healthcare that we are providing to the population, and of course, promoting health, because we all believe that good health practices, good hygienic practices would help us to promote the health and then to contribute to preventing diseases and prolonging life and have a better quality of life. So that's the context. And what he also mentioned is that is through a very organized community effort. So it is not in a very individualistic and a silo way, but looking at more comprehensively as how community is engaged in all these activities. But this definition subsequently was expanded, and there are a lot of other contributions to the understanding of public health. But I also wanted mention the definition of public health that 10 years back, the Institute of Medicine has looked at is what we as a society do collectively to assure conditions in which people can be healthy. Now you see that difference between these two definitions apart 90 years. You would find that this is much more broader definition. What it tells us about what we as a society, all of us as a society, do collectively to assure conditions in which people can be healthy, which actually incorporates multiple dimensions of public health, multidisciplinarity of public health, engaging with multiple sectors so that that can contribute to enhancing the population health. And therefore, this is much more broader definition of public health, which also actually tells us we need diverse workforce, because you all are students of public health, but your focus area of working in public health, mostly in the health sector, would be related to the management and administration, because you are the students of management and administration program. But you are going to play an important role in public health. And similarly, there are many other programs where people can contribute to the public health, and it's collective effort of all of us actually help us to advance the public health. And therefore, if we wanted to really revisit who is a public health professional, a public health professional is a person who is educated in public health or related discipline, because you may not be students of core public health program like masters in public health or MD in community medicine or preventive and social medicine. They are very core programs, but you are the student of health management, hospital management. It's a related discipline contributing to enhancement of public health. Therefore, you all are public health professionals, because finally you would be employed to improve the health through a population focus. And everybody then therefore contributing to the public health becomes a public health professional with this broader understanding of what public health is all about. And therefore you can see that I presented a variety of the specialists who contribute to the public health. There could be very core public health specialists that you can see, people from nutrition background, people from public health engineering, like for example, sanitation for that matter, even appropriate technology role in public health, health communication experts, environmental experts, even the veterinary physicians. You would remember and recognize the role of the One Health, because there's a tremendous interaction between animals, humans, and environment. And the science which deals with that in the context of health is the One Health. Therefore, the role of the veterinary physicians coming to the public health. Data management, like we have a huge data sets. We need people who would manage that and help us to understand the dynamics of disease behavior in the communities. Health economist, understanding the economical interventions, occupational health, health administration, and there you would also find program managers. Several of you probably would work as program managers, work in hospital setting as hospital administrators, or you work in the community as the project managers. So all of them contribute to the public health, and all of them represent public health as a profession. But we all also need to understand that can then one discipline produce all of them? We need to understand public health has several feeder disciplines. And I'm sure several of you have a background, like you came from dentistry, some of you might be having background in biotechnology, some of you may have background in journalism, law, or some of you may have life sciences background, some of you may you have medical sciences background, health sciences background, Ayush background. You come from a different discipline to the public health, and you have consciously, systematically, and strategically chosen the path of the public health. and you wanted to acquire the skills in the domain of health management and hospital management, which is critical to understand that all these disciplines therefore contribute to the public health. You would see that over a period of this 2 years program, that all these disciplines, when you understand as a part of health management program, you will study the health economics also, the application of principles of economics in the context of the health. You will also study the role of social sciences for that matter. Public health nutrition is also important. Of course, the management and administration would be the core principles that you would study. Epidemiology is a tool that everybody needs to understand the principles and tools and techniques of epidemiology in moving forward in public health. And therefore, the point that I wanted to mention, even biostatistics for that matter, the point that I wanted to mention here is that we draw upon the principles, the tools, and techniques from the variety of the disciplines, including the core management principles in advancing public health, in understanding public health challenges, designing solutions for public health, and interventions that are to be implemented in the community. And therefore, the message number one for all of you who have joined this program, and it's an induction program, is that public health can be considered a discovered discipline because it is not the person's initial profession. We all came from a different diverse background into the public health, but this is the choice that we all embraced later on in our career, and we wanted to work in the field of public health. You may be a program manager or a project manager or a hospital administrator, but you becomes a part of larger public health family. But let's begin to understand then, because understanding the public health from a national perspective, let me tell you the public health challenges that we in India are currently confronted, to give you a glimpse of how critical these challenges are. For example, you take Human Development Index, which much broader index basically, which also incorporates health, but which is a much more broader index. And where we are ranked globally, you would find we have 131 rank out of 189 countries in 2020. But if you wanted to look at sustainable development, and the index that we use for sustainable development is called as the SDG index. On that index, we are ranked 117 out of 156 countries. Human happiness index, because happiness goes in hand with health, we are ranked 139 out of 149 countries. Our life expectancy is second lowest in Asia. If we wanted to revisit infant mortality rate, it may be around 30 presently per 1,000 live births. But if you look at the countries like Sri Lanka or Nepal or even Thailand for that matter, Bangladesh, they are performing much more better than us in infant mortality rate. Our immunization coverage is almost 65% or so. Third of our children are undernourished and underweight. If you look at the India's demography, average age of Indian population is 29 years, but 65% of our population is less than 35 years of age. 50% of our population is less than 25% of 25 years of age. And so we are amazingly young nation. If you look at the average age of Japan, it's around 47, 48. United States and China, it is more than 40 years. Europe is almost 46, 47 years for that matter. And our average age is Indian population is 29 years. So there is a demographic dividend, but unless we have a healthy and educated population, how do we conquer on that? On one hand, we say that a third of the children are malnourished and underweight. And on another hand, we say that we have a tremendously young population. Then if we really wanted to leverage that, we'll have to respond to the challenges of malnutrition. In terms of communicable diseases, just take an example of tuberculosis. 25% of global disease burden of tuberculosis in India. Non-communicable diseases, I'm taking some illustrative examples. Diabetes for that matter. 70 million people in India suffer from diabetes. India is labeled as the capital of diabetes for that matter. Air pollution. 1.6 million premature deaths every year in India are attributed to the air pollution. That translates to 49 million days lost because of Delhi's lost because of the air pollution. 9% of national disease burden can be attributed to the air pollution. These are challenges that we are confronted with. Our per capita disease burden is significantly high as compared to several other countries globally. In terms of inequalities are concerned, if you look at infant mortality rate in rural areas and urban areas, there is absolute significant difference. You take any state, like for example, in Assam, in two adjacent districts, you would find in one district infant mortality rate is 37, and in adjacent districts, it is 73. Mewat is a district in Haryana, which is almost 50, 55 kilometers from a national capital where the power of India sits. And you pick up any indicator, maternal mortality related or infant mortality or under five mortality or a malnutrition, and you would find that we have several challenges there. A girl child born in Chhattisgarh and Madhya Pradesh is 5 times more likely to die in the first year of life as compared to a girl child born in some state like Kerala for that matter. From infrastructure point of view, you would also find that we have total 20% of the global disease burden in India. But for that, we have only 8% of the global doctors in India. We have only 6% hospital beds in India. And now you would realize the struggle that this country is experiencing, particularly in the second wave of COVID-19, because of the shortage of the hospital beds, is known to all of us. Unless we strengthen our infrastructure, how do we deliver quality health services to the population? So some of the areas of the concern that I have presented, the information is a bit of a negative and dismal also. But you should recognize at the beginning of your career that India's national bird is peacock and not the ostrich. And why I'm saying so is that because our national bird is peacock, we have to look around to see where are those problems. Unless we identify those problems, we'll not be able to fix those problems. We cannot be the ostrich. And therefore, we need to recognize what are the challenges, and we need to be truthful in recognizing. Unless we say that there is a problem, we'll not be able to make any serious effort to identify solution and correct those problems. And therefore, in that right spirit, I presented certain facts which are public health challenges for the country. So the message number 2 for all of you is India's health problems is a matter of concern for all of us. And therefore, I would like to congratulate all of you for joining the stream of public health. And you wanted to make career in public health because we need enthusiastic, bright, young professionals to work in public health to take care of our public health challenges and problems. Now, having talked about these are the challenges that we are confronted with. But how do we confront these challenges? How these challenges can be effectively responded to? Because talking about problem is one thing, but we also need to identify the solutions for the problem. And therefore, I will now restrict my thoughts in two areas, in two buckets. One is that let us understand what are the root causes of these problems, why these problems are there. As I mentioned to you that 70 million people are suffering, suppose, for diabetes. Or if I mentioned to you that we have 25% of global burden of tuberculosis. Or as I mentioned to you, a third of our children are suffering from malnutrition. Or I mentioned to you a problem of air pollution, where I mentioned that 1.6 million premature deaths every year are attributed to air pollution. We need to identify what could be the solutions to these problems. That's number one. And for that, we need to understand what are the root causes. And then also to try to understand how health system can be used for confronting these challenges as a delivery vehicle. So let's confront on and let's talk about what influences the health of the people, because we need to be much more in broader sense of understanding what actually contributes to these problems. And several of these problems are, comes from the different aspects of our life. Income and poverty, education, water, sanitation, even food and transport, health beliefs and practices. I talked about air pollution, climate change, health and social services, rising levels of risk factors, overcrowding. There are a variety of the factors which contributes to our health. And they all contribute. Like, for example, waterborne diseases. Sanitation and water is related to quite significant proportion of waterborne diseases. Our health beliefs and practices contributes to the health promotional related issues for that matter. Air pollution I talked about. Rising levels of risk factors is giving rise to several non-communicable diseases. Our food practices have tremendous influence on the health, and I'm going to talk about it. Climate change is the new identified area that also contributes to and impact our health. Professor Michael Marmer tells us that the conditions in which we are born, grow, work, live, and age, all these conditions have influence on our health and contributes to a variety of the conditions. And therefore, we need to recognize that health is also affected by several determinants which lie outside the conventional health sector. Because when we work in the health sector, we believe that our job is providing healthcare to the population, which is extremely important and which is at the center stage. But beyond that also, there are several determinants which are beyond health sector, which also influences the health. And unless we take care of that, there will be a rising demand for the healthcare. So prevention is important, and we all know that prevention is better than cure. And therefore, the health promotion, primary prevention, secondary prevention is very important if we really wanted to reduce the burden on our health infrastructure. And therefore, it would require multidisciplinary, multi-sectoral, and multi-layered approaches into the public health. And I will give some examples of that. Why I'm talking, when you learn public health, don't think that our role is restricted to providing healthcare to the population. Of course, the health system has to be there, which would provide, and that health system should be more equitable and more efficient also in providing healthcare. That is important. But the healthcare is required when the people get sick, when they have diseases. But even before that, what we can do is more important in public health. And I will give an example of how, therefore, policies in other sectors are important from a public health perspective. And you would all agree that smoke-free laws and increased taxation on tobacco products, these are very effective strategies for reducing the heart attacks and strokes. And World Health Organization and World Bank and several other people had done a lot of work in these areas, and we are all aware about it. But the researcher at Stanford, this Dr. Sanjay Basu, has modeled something a few years back for all of us. And what he tells us that if we can implement smoke-free laws and tax every tobacco product appropriately, there's a huge number, that is 25% of our heart attacks and strokes during a period of 10 years that he has modeled data from 2013 to 2022 can be taken care of. So if we really wanted to reduce the burden of our healthcare, if we wanted to really reduce the burden on the people of this country suffering from heart attacks and strokes, if we really implement these smoke-free laws and taxation policies are implemented appropriately, we will have a tremendous impact, and this will have more impact than all the drugs that the cardiologist of this country would prescribe. This is an example to tell you that, therefore, engaging with the ministries which are responsible for implementation of the smoke-free laws and taxation is important. Another example is 20% tax on sugar-sweetened beverages will be able to prevent almost more than 11 million cases of overweight and obesity and 400,000 cases of diabetes over the next 10 years. This is another example. I will tell you these major risk factors which are responsible for non-communicable diseases. Now, in public health, you will learn that when on one hand, we continue to struggle for infectious diseases, when we had started thinking that our immunization program and our national programs are dealing with a variety of infectious diseases more effectively and efficiently, COVID-19 actually reminded us that the emerging infectious diseases are likely to be there. But on the other hand, there are emerging incidents and prevalence of non-communicable diseases. And how can we prevent non-communicable diseases? You can see that these 5 major behavioral risk factors which contribute to non-communicable diseases: tobacco use, alcohol use, inappropriate diet, physical inactivity, air pollution. Now we need public health interventions to work around these 5 behavioral risk factors so we can reduce the non-communicable disease burden in the communities. This is another example that we need to go beyond health sector if we wanted to really reduce the impact of the use of alcohol in the community, or if we really wanted to promote the appropriate diet, junk diet prevention, or the sugar and sweetened beverages, and so many other things for that matter. Promoting physical activity in the population, you would need interventions beyond that. And in the context of that, I wanted to mention a power of policy for chronic disease prevention. Let's take an example of tobacco for that matter. Tobacco, we all know, contributes very significantly for several conditions, several non-communicable diseases for that matter, not only the respiratory conditions, cardiovascular, neurological conditions, significant contact cancers for that matter. But if we wanted to take care of tobacco related diseases in the community, we will have to work around the taxation policies of the government. We'll have to see that issues related to advertisement bans, smoke-free policies by the government, then the health warnings for that matter, and they are all very effective. And there was a study carried out in 2 decades time, which tells us that close to 50% of the mortality in United Kingdom was attributed for reduced smoking. There's a huge amount of data is emerging in that particular context. These are the two graphs that I presented to you, which tells us about the impact of taxation on cigarette smells in France and South Africa. And you can see that when the prices go up, the taxation policy is in place, the consumption has reduced. And this is called as the triple hall double. That is, the tripling of cigarette prices has halved the consumption and double the inflation adjusted government revenue. This is another example which tells us that the interventions beyond health sector are critical and important. Air pollution, I talked to you about. We all understand that air pollution is a very significant leading cause of death and disability globally, and India also. I talked about the numbers also. But if we wanted to prevent air pollution, both indoor and outdoor, the policies would lie beyond health sector. Providing, like for example, use of cheaper cooking fuels is one of the very important contributor to the indoor air pollution. So the message number 3 is that assuring health requires approaches beyond health sector. We will have to move, when you are a part of the program, you focus that there are interventions beyond health sector which are critical for improving the population so that we can advance the public health agenda. Now let's reflect on state of India's health system, because finally we have to provide healthcare to the population. We have to provide quality and dignified healthcare to the people of this country. And therefore, it is important to reflect on the health system. This is the health systems framework, which is a very traditional, conventional health systems framework. And you will definitely get an opportunity to study this health systems framework as a part of your program in more detail. But what at this point in time I wanted to mention is that there are 6 building blocks of this health systems framework. First is the service delivery, that the quality of the care that we provide to the population. Second is that for providing that quality health care, we need people in place. We need doctors, we need nurses, we need allied health professionals, we need public health professionals, we need health management professionals, we need pharmacists, we need frontline workers. Then information systems. Unless you have a strong health information system, we will not have a resilient health system. Medical products, vaccines, technology. You are seeing now the struggle for vaccines in our country for the COVID-19. We had seen this last year exactly for the testing upgradation in the country in terms of like RT-PCR testing or antigen testing for COVID-19. Health financing is important. Leadership and governance is critical and important. I will just give an example of health financing. The public spending on health in India is around 1 to 1.1% of our GDP, which is pretty lower as compared to other countries globally. Our national health policy mentions that we need to enhance that to 2.5% of our GDP. Unless we have financial resources, how do we strengthen our health system? So if we take care of these 6 building blocks, we will improve the healthcare to the population in terms of access to healthcare, coverage in the sense large number of people are getting benefited out of that. Quality is ensured, safety is ensured, and finally we will have improved healthcare. We will have health systems which are more responsive. We will have social and financial protection and overall improved efficiency. But on the right side, you can see that the people are at the center. Unless you have people at the center, we will not be able to respond to all these challenges, because our health system has to be people centric. And therefore this is a very very lovely and very popular slide which I have created and I would like to present, is that what kind of health systems that we need in the country. We need strong and sturdy healthcare system, sustainable, vibrant, robust and resilient, agile, efficient, resource optimizing, effective, equity promoting. It is important, inclusive, empathetic, people centric, responsive, technology driven, and culturally sensitive. So these are the issues that we have to look at when we talk about the health system in India. And these are the characteristics which we should actually ensure when, like for example, equity. uh, it should have access to poor, those who are have-nots, those who are not able to afford the healthcare. It should be culturally sensitive. We should use technology like use of telemedicine for that matter. So that is a stronger health system which we require for providing healthcare to the population. So in the context of healthcare, like I wanted to mention what Dr. Tedros, who is the Director General of World Health Organization, a few years back said, this is an outrage. No one should have to choose between death and financial hardship. But the shocking truth is that this is the reality for millions of people every year. And the next statement is more important. What it tells is that globally, 100 million people are pushed into the extreme poverty. I'm talking about extreme poverty every year because of health spending. And that translates to 3 people every second. So every second globally, 3 people are pushed into the extreme poverty because of the health spending, that is the out of pocket expenses that we all spend. And therefore it is more relevant in the context of the health system. The building blocks that I talked to you about, like one of those was building block was health financing, health workforce, and others, is important that we invest in those, each building block, so that our health system is strengthened. We also continue to talk about an equitable and efficient health system cannot be developed without adequate public financing. This is very critical and important. And in the context of now COVID-19, Dr. Tedros went on to tell us that we throw money at an outbreak. Now you would have seen that, right now we have outbreak, this COVID-19 pandemic. And now we are spending money, and which is necessary, of course, which is absolutely essential, upgrading our hospital beds, increasing the number of hospital beds, oxygen, like creating oxygen plants at the district levels so that the sufficient oxygen is available for managing patients of COVID-19. In fact, manufacturing of certain drugs, we are now investing that. Even last year when testing was to be scaled up, then initially in Maharashtra, there were hardly 2, 3 places where this RT-PCR testing was done. Now, practically in each district and in big cities, you will have multiple places where this RT-PCR testing is done. Of course, it is important, but look at from a perspective what he said. We throw money at an outbreak. When it's over, we forget about it and do nothing to prevent the next one. This is dangerously short-sighted and frankly difficult to understand. The point that he is emphasizing is that we need a long-term strategy to strengthen our health system. We cannot have piecemeal approaches. We cannot have knee-jerk reaction responses that there is a problem and then we wake up and then we see that we need to do something. We have to systematically invest strategically, consciously over the period of time to see that our health systems are strengthened. Therefore, I wanted to say we need to recreate systems that can anticipate, avert, attenuate, and abbreviate any health threat like COVID-19 that currently we are experiencing, while dependably delivering other needed health services. Our focus should be on COVID-19, but we should not forget that we are still confronted with several other problems. So dependably delivering other needed health services. They may be related to maternal and child health, other infectious diseases, non-communicable diseases, and so many other, with efficiency, equity, and continuity and commitment. So that should be the approach of dealing with and strengthening the health systems. A strengthened public health sector is therefore must be the centerpiece of the new health systems architecture, because in India, private health sector is very critical and plays very predominant role, which is not only welcome, but which is critical and crucial for the healthcare delivery in India. And we must appreciate the role of the private sector in this country. And therefore, when we talk about this PPP model, generally you would learn this PPP means public private partnership. Everybody will tell you that PPP means public private partnership in health sector. But I will tell you another acronym for this PPP. I would say that private for public purpose. PPP means we should look at private sector for public purpose, because even a private sector basically works towards enhancing public health, population health, enhancing and providing healthcare to the people. The government cannot reach everywhere. The government cannot do everything, and private sector plays an important role. And therefore, you also remember this acronym as private for public purpose, because that is important. But having said that, I also wanted to mention public sector needs to be strengthened, and it should be at the center stage of the new health system that we talk about. Therefore, leveraging learning from COVID-19 pandemic that we all are confronted with in the context of strengthening health systems in India, we'll have to look at revisiting health system architecture, reanalyzing our public health challenges, re-articulating our public health priorities, and redesigning new health system for the 21st century. If we all do this, we will be able to advance the agenda of health assurance and sustainable development. And that would help us to create Swachh Bharat along with Swasth Bharat and Sashakta Bharat for all of us. So the message number 4 is India's health systems needs to be strengthened. I also wanted to mention, see, we should not sometimes have a very narrow focus. What we feel is that we all are responsible for providing healthcare to the population. We all are responsible as public health professionals as the custodian of a population health in this country. But we have to also see, when we work in health sector, we also contribute to the economic growth. When we work health sector is, over the period of time is actually generating a lot of employment also. So our contribution to the health sector is also important. So from the health sector, and this is a very simple picture that you would tell us that in the health sector, we contribute to directly improving the health service delivery, which will have implications on better health outcomes. When we have a better health outcomes, it is also identified by one pathway that there is a improved schooling, because primary education, secondary education is still a challenge in our country. And by improved schooling will also contribute to the rise in productivity, but even directly better health outcomes can contribute to the rise in productivity. When there is a rise in productivity, we have a healthier people in the country. As we have a healthier nation, they will also contribute to the economic growth. Economic growth will also generate the employment. And when we talk about better health outcomes, they will also contribute to generating the employment, and employment other way around contribute to the economic growth. And employment and health sector is also directly related. Like I wanted to mention that in India's health sector, we have 5.7 million people work in the health sector in India. Of course, China has 10 million people, even more than that. But our statistics tells us that 5.7 million people work in the health sector in India. So these 5.7 million jobs, if you look at the larger picture in India, are created by the health sector. One health professional globally provides an opportunity for a job for 1 to 2 other people, like support services. You need administrative staff, you need receptionists, you need ambulance drivers, you need dietitians to work in the kitchen. There are a lot of sweepers and other people. So there's a significant contribution. So that's how we should look at, and particularly when we advocate for the public health, we have to advocate for this particular picture and this particular framework, that health sector is not only, although the primary responsibility of the health sector is to improve the population health, improve the people's health, but also on the sidelines, we contribute to the economic growth and generate the employment for the population. But then I mentioned to you that strengthened health system will contribute to the health assurance. When I say health assurance, it is assurance about the health to the people of the country. And what kind of health? The health that we all dream, desire, deserve, and demand. So that kind of a health, and the strengthened health system will help us to provide this assurance to the population of this country. And therefore, if you look at this sustainable development goals that some of you might have seen this picture also, there are 17 sustainable development goals. And if you can see the goal number 3, that is good health and well-being. And these goals are to be achieved by 2030. And they have identified target indicators, and there's a lot of frameworks are available for tracking these goals. But we work in the health sector, so we are directly concerned with the goal number 3, that is good health and well-being. So we have to see that we can advance public health to reach goal number 3. But the point I'm wanting to make here is that even other goals are related to health. Like example, the first goal, no poverty. We all know that poverty is related to the health. I mentioned to you that 100 billion people every year are pushed to the extreme poverty because of unaffordable healthcare. Zero hunger. If the people are hungry, people don't have food to eat, will have impact and implications on the health. You take goal number 10, required inequalities, gender inequities, goal number 5. You can take an example of climate action, goal number 13. You take an example of clean water and sanitation, goal number 6. So the point I'm re-emphasizing is that they are all interlinked. And if you work around one goal, like goal number 6, suppose, clean water and sanitation, if there is an improvement on that, it will also contribute to goal number 3. Goal number 4 is quality education. If you improve the education, we know it has implications on good health and well-being. And therefore, we should be seen ourselves as an instrument in advancing sustainable development goals also for that matter. So the message number 5 is that we have to advance the agenda of health assurance for moving towards sustainable development goals. And that would help us to create Swasth Bharat along with Swachh Bharat and Sashakta Bharat when we work in public health. So at the end, you need to be the change you wish to see in the world. And I would like to congratulate you for choosing, and your parents also for that matter, choosing to work in public health. We need people with passion, people with tremendous potential to work in the area of public health to advance the public health. So thank you so much for this opportunity, and we'll be happy to respond to questions if they are there. Thank you. Over to you.
Yeah, thank you very much, sir, for giving our students of MBA Hospital Healthcare Management insight about public health professions, the key health indices of India, overview of challenges and the way ahead for solving public health system problems, and also a different approach to look at the PPP models. I will be selecting students. Ms. Ahuna Mukherjee, please, you can unmute and go ahead with the question.
Yeah,
Good morning,
just
sir.
Ankit,
Yeah,
just a
sorry, sir.
minute.
Yes, sir.
So thanks, Sanjay. I'm just getting into another meeting. As usual, your lecture was more of a discourse to the students and a treat to hear. And I think so. Simply put, you put public health as the health of the public, and as healthcare managers, whether they're working in corporates or in the private sector, they need to understand that public health is ultimately for the public good, for which they should stand up. So I've heard this comments many times from you, these contents of this lecture, and every time there's a different and an additional takeaway for me. It's also a process of learning. Thank you so much, Sanjay.
Thank you, Raju. Such a pleasure to be part of this discourse and delivering talk to the young professionals. Thank you, Raju, for this opportunity.
And if you recollect, when we were designing the Masters in Public Health program, we said that there has to be an interaction between the students of the MPH program and the MBA Hospital and Healthcare Management program also.
Absolutely. Absolutely. Yeah. Thank you.
Thanks, Sanjay.
Thank you.
Please carry on, Professor Ankit.
Thank you, sir.
Good morning, sir.
Yes, Ahuna, please go ahead with the question.
Sir, as you mentioned, inequality as one of the challenges of public health. So what is the government doing to tackle this health inequality situation?
Yes, very important question. See, inequities are handled through interventions in our health system. For example, now, unless we strengthen public sector, because public sector provides healthcare either at reasonable cost or free of, free. And therefore, unless we have sufficient beds, unless we have sufficient hospitals, uh, it will not be available for the poor people. Rich people can go to the private hospitals, they can seek the healthcare, but unless the hospitals are available for the poor people, when the beds are available, when the doctors are available for the poor people, their health will not improve. And therefore, the investment of the government to create infrastructure, more number of primary health centers, more number of hospitals in the country, to have more number of medical colleges, to have more number of nursing colleges, so that we have more number of nurses being available to do that. So all these interventions basically are towards reducing inequities. So strengthening infrastructure, creating human resources, these are all interventions done by the government. Although private sector will also come out with new hospitals and new setups, but the government will also have to upfront. Even the government's commitment in our national health policy to increase funding from 1.1% of GDP to 2.5%. Well, it's a public spending. So when public spending grows, it is available for everybody to reduce the inequities. So there are several initiatives by the government, even this Pradhan Mantri Arogya Yojana, Ayushman Bharat. These are all initiatives towards reducing inequities. Thank you.
Thank you, sir. We can
Thank you,
have the
sir.
last question for the day. Shraddha Davle, can you please go ahead with your question?
Good morning,
Shraddha,
sir.
yeah.
Sir, I wanted to ask, like you mentioned, the private for public, PPP model as private for public. So, as management professionals, according to you, where should we start if we really want to work towards public health? And like we see that even after the government has implemented various schemes and policies, still people are unable to access to the healthcare. So, how can we work towards that so that healthcare is accessible to all?
This is again a very important question, and I see a value and I see relevance and importance of role of public health managers, hospital and health managers in the context of public health, because see, a lot of issues are related to the management at times. At times, you would also realize that sometimes it's not the availability of the resources, but appropriate and efficient utilization of whatever resources that we have. And when you talk about management, like human resources management, even financial management, even organizational management. So all these are tools of management and techniques in the management, principles of management that we can use to deliver our public health programs in a better way. It doesn't require sometimes earth-shaking interventions. There are small interventions from the management perspective. When suppose you are working in a program as a program manager, in a public health program or in hospital management. So in a hospital, you can think of what kind of management tools can be used with given resources. Also, we can improve the effectiveness and efficiency. And therefore, the role of the management is very important, and role of the management professionals. And if you see, therefore, they are a very integral part of the larger public health workforce. And our national health mission, initially National Rural Health Mission, has seen when the management professionals have entered into the sector, there has been an improved efficiency and effectiveness in delivery of the quality of the health services. So thank you.
Thank you,
Thank you,
sir.
sir.
Thank you, sir, for sharing your words of wisdom. We look forward to have more such interactions in future as well. We have a long list of questions, but due to paucity of time, we cannot take all of them. We will compile them and send it to you, sir, for your responses. Thank you, sir.
Thank you. Such a pleasure. Thank you.